So I am here with Susan Karras, the Director of Public Health Nursing for the McHenry County Department of Health. And we're going to talk a little bit about the county's contact tracing efforts today. So just to get started, back in April and May, we heard Governor J.B. Pritzker, sort of introduce to those of us not in the realm of public health, this kind of concept of contact tracing and how as we began reopening the economy, contact tracing and sort of ramping that up at the state and local levels was going to be an important way to do that safely. So just to start off, if you could sort of give us a little bit of a feel for how the McHenry County Department of Health ramped up its contact tracing efforts, since the pandemic began and, kind of where we're at now.
Okay. Yeah, public health has always done contact tracing. I think I just want to clear that up too, that this is something that we have done for decades. It is an intervention that helps us to mitigate the spread of all infectious diseases that occur in the public. So it is something that we do, that we have the capacity to do within our county and have done successfully. But of course, with the pandemic, the volume and has increased, which is taxing our capacity here at the health department. We did receive some grant dollars to expand that capacity. And with that, those grant dollars we did receive in August. So we started that process of onboarding additional staff. So we have onboarded 20 additional staff within the health department to do just contact tracing, in addition to the individuals that we have employed here to do that kind of work. So we average about 15 to 20 a day doing that contact tracing. We've also contracted with a private company to give us the ability to expand during surge times, such as what we're experiencing now, so that we have the capability of expanding up to 25 additional contact tracers, and if need be beyond that, 20 additional ones. So we have the capacity, or our plan is to be able to expand to about 60 to 65 contact tracers as needed, based on the volume that we're getting in. So that's kind of where we're at with that right now.
Okay, interesting. So that those sort of contracted workers that you guys can use, it sort of acts as a B team, people that you can pull up as needed. So as far as your core staff, is the effort to ramp up that staff then still continuing? You mentioned getting to a number as high as 65, depending on how much of a resurgence we see over the next coming weeks and perhaps months. So are you still looking to hire, or will you be kind of relying on that second string of contact?
Currently, we're relying on that backup surge plan. So we believe that the capacity that we have internally, we can manage with the high volume of cases that we were even getting before this surge. But with the surge, we have that capability to expand and contract. So we're using those dollars wisely as well, so that we're not hiring people that aren't we're not able to use if we come back down. So we have that flexibility to move back and forth, expand and compress. And I feel very comfortable with that plan moving forward. Now, will we need to pivot and make changes? Possibly. We're always evaluating daily where we're at, what's going on. We run into barriers. We have illnesses, that occur, just like everybody's experiencing. And if we, have that decline, what is our plan to, that supplement and that backup plan for that as well. So we're constantly pivoting in the health department here and evaluating daily on where we're at, what's happening. If we identify barriers, what are those barriers? Are there barriers that we have control over versus barriers that we don't have control over? And how do we address each of those? So it's a constant pivoting, constant evaluation that we're doing daily here.
And when you talk about those barriers, I wonder, when it comes to your core staff, are you experiencing high rates of turnover among those contact tracers that are on your team?
No, no, we're not experiencing any, high rates of turnover. We do worry about burnout because they're working a lot of hours. So we're trying to watch that very closely. Not only is the stress here at work, but I think we all can relate to, we have stresses in our personal life because of the pandemic. So, kids, being at home, spouses, illnesses within the family. There's a lot of stress across the board, personally and professionally, while they're here. But we have not experienced a turnover. I'm proud of that, and I think it's because we are trying to watch the mental well-being of our staff, and making sure that they're taking those mental breaks.
Another thing I want to talk about, as we've seen this sort of ramping up of contact tracing at, both the state with the Illinois Department of Public Health and at the local level, I think, since this is a relatively new concept, obviously not for you guys, but for the rest of us, there does seem to be a sense of nervousness around, contact tracing sometimes amongst the general public. And I think, perhaps some of that comes from a lack of understanding as far as how it works. So I guess, what would you say to folks who might be nervous about participating in contact tracing if they, have to?
Yeah, I do just want to assure everyone. I know that, we have had, just to give you kind of an overview of what we're experiencing here in McHenry County, just in September alone, we had a 16% uncooperativeness with case investigation and contact tracing. In October, that increased to 32%. So we have a high rate of individuals not cooperating here in McHenry County. I think across what we're hearing from our partners in other counties, they're experiencing it as well, but we seem to be experiencing it at a much higher rate than other counties. So we're very concerned about that, and we have been trying to explore what is happening. The concerns that we're getting for those that share with us why they're not cooperating is the fear of the stigma. And they don't want people to know if they've exposed somebody, that they would be blamed for that. So I think there is that stigma out there that's attached to being diagnosed with COVID or identified as a contact. Also, there's the burden of the isolation and quarantine that we're asking them to do. Because it is quite, for those that have experienced it, it is not easy, to isolate yourself for 10 days and quarantine your family. And that family can be quarantined for quite some time as new cases, if they develop symptoms, then that quarantine cycle starts again. So it is a burden on families. And with our program, we do have community health workers that if they participate in our monitoring, and we can get into that too, with the isolation quarantine, we're there as a resource for them. So if somebody is struggling with, just even getting groceries or prescriptions, in order to help them comply with those orders of isolation and quarantine, we will get those, we will help them and resource to get those needs met, and resource with them as far as any kind of employment issues, as far as getting them in touch with people that can potentially help them, or resources that are in our community that can help them, or at the state. So that's part of the contact tracing too, is not just garnering that data, but offering that support to those that we're asking to isolate and quarantine. And I think the biggest concern that we're hearing is confidentiality. Individuals are concerned about the information that we're asking, because we are asking a lot of private information and who they've been in contact with. They're not comfortable sharing that. There has been since the beginning of the pandemic, some concerns that have been coming up regarding confidentiality from the very beginning with this. We take this extremely seriously here at McHenry County Department of Health, and we've actually fought to protect the rights and of the personal health information and private information of the constituents we serve. It is a part of the Illinois Administrative Code that we're required to follow. It's section 690.200, subsection D. If anybody would like to read that, it is all about the confidentiality and what we're obligated to protect and how we go about protecting that. So again, we take that extremely seriously, and we try to reassure people that it is confidential. If information gets out about that individual, it's usually because the individual has reached out to those contacts themselves, which we encourage people to do, to let people know, because there is a lag time of when we know. So somebody could get diagnosed with, COVID. They're informed by their physician, they inform their employer, they inform their friends, that they've been around. We may find out about it, for 24, 48 hours later, once it gets into our system from that provider. So a lot of times that process has started before we even reach these individuals.
Mm-hmm.
And I know there's a concern, because then if it gets out that it's them, they're angry, they're upset. And we just try to assure them that we're here to protect that information. We're obligated to protect it. And we take it very seriously.
Hmm. And so then, as far as the process that you just highlighted, of someone's doctor, delivering a positive test result, and then that being communicated to you guys, and then your contact tracing team reaching out to the individual. Is there any way, if I've received a positive test result, that someone could contact you guys directly to, I guess, just sort of circumvent the process and be more proactive about it? Or is that sort of just not how it works?
Yeah, I mean, we do have individuals call and say, I'm positive. I'm not real clear what the expectations are, or their physician says call the health department for guidance. So we do get those calls. We get a lot of calls from their employers if they're notifying their employers saying, hey, I was diagnosed, I'm positive for COVID. The employer will call us for guidance. And as you can imagine, though, our call volume is extremely high. We can have 100 people here working just contact tracing, and the number of calls, there would be a lag of us getting back to them. But we do the best we can to reach out to anybody that calls and return their calls and answer their questions in a timely fashion. But what we really want to enforce with that is to people just to be aware and knowledgeable about what the expectations are. Don't wait for us. Be knowledgeable about what you should do as a citizen of this county to help us. We need to work on this together. There's guidance that's easily found. Go to reputable websites, CDC, IDPH, our website. There's a lot of resources, a lot of information there as far as what to do if you do become positive, or if you are a contact. Businesses, long-term care, the guidance is out there, and they have all, I think McHenry County has done a really good job as far as being informed about what mitigation they need to do in their places of business, and what do they need to do when they have a case. Because to think that you're not going to have a case is not realistic. We are in a pandemic. It's a new infection for the human species. People are going to get sick. We have to get back to that message of flattening the curve, and how important that is, because people are going to get sick. So when it happens in your facility, in your school, in your daycare, in your home, what are you going to do? You need to be knowledgeable about what you need to do to reduce that spread, to help flatten that curve. So we're asking people to be knowledgeable, keep up with reputable information, and work. Everybody needs to work together.
Okay. Thank you for that. And so, for folks who might just be a little bit nervous about this process, I want to walk through like really explicitly what it looks like. So, if I've chosen not to, proactively call you guys, or if, I did leave a message, either way, how do I know when I'm being contacted by a contact tracer? I get a lot of calls from numbers that I don't recognize.
Right,
What would that look like? Is it going to be a local number? How do I know to answer the phone? And then, go from there. What questions am I going to be asked? And what are sort of the very specific procedures so people perhaps know what to expect a little bit more?
Oh, great. Yeah, you will not get a call from a local number. It is going to be a call from a number, it's 312-777-1999. It will show up, we're hearing it does, and then sometimes it doesn't. It does also show up as COVID tracer, like on your phone. So that is the call coming from the health department regarding contact tracing or case investigation. So when that call comes, of course, we want you to take that call. If you're a case, if you're a positive case, we're calling you. We're going to, confirm that you're positive, that you were made aware that you were positive. And then we ask about symptoms, and we ask about onset of those symptoms, because the onset date is important for us because it helps us determine when you are infectious. So you're infectious, you're considered to be infectious 2 days prior to your onset date of symptoms, and then 10 days after that onset. So your onset date is day 0. And then there would be 10 days after that you're considered infectious and 2 days before that you're infectious. So that gives us the window that we need to do contact tracing in.
Mm.
So we're going to ask you, where have you been in that time frame? Hopefully when you were notified of your symptoms, or that when you became symptomatic, you isolated right away. We're finding that people are thinking, I don't think it's COVID. I feel like it's more of allergies. So I'm going to continue to go to work until I get my results. Then we get the results, they're positive. So the idea is if you're not feeling well and you are being tested, you really should stay home till we get those results, because you can be potentially, unwillingly exposing people. So with that window that we, are able to define from the interview of when you started your symptoms, we start asking, where have you been? And who have you been in close contact with? And a close contact is somebody that's defined as being within 6 feet for accumulation of 15 minutes in that day. Okay, so we would go 2 days back and say, where were you on that day, and who are you with? And when you were with them, what interaction was it? So we're assessing the risk level for those contacts that could be in contact with you. Were you wearing masks? Those are all questions that will, that are going to be coming out. What intermediate mitigation was done, because it may not be a high risk situation, or it is a high risk situation. We do automatically quarantine households, because household contacts have a high rate of transmission of COVID, particularly spouses. We see transmission in households almost in every incident. So we do quarantine those individuals immediately upon notification of that case in the household. So once we get this information of locations they've been at, their contacts, their employment, all those, that is all gathered, we determine in those settings who could be potential contacts. So we try to get the names of those individuals, whether it's calling the employer and saying, hey, we need, individual X, Y, and Z, and their contact information. They share that information, and they're legally, allowed to share that information with us under the code that I mentioned earlier. We're obligated to keep that private and confidential. So then what we do is then contact these contacts that we've identified as being a close contact. When we contact these contacts, we don't reveal who their contact was. We basically say you have been identified as a close contact to a COVID positive case during their infectious period. And then we go through, are you having any symptoms currently? And if they're not, we provide education on the importance of quarantining, that we want them to quarantine. We usually recommend getting tested at day 5-7 because that's typically when we see the conversion to positive. We ask them to opt into our monitoring system. And that monitoring system, for the 14 days that we are putting them in isolation based on their date of exposure, they will get either a text, they choose text, email, or phone call every day, asking them, how are they doing? Is there any resources that you need? Do you have any questions? If they become symptomatic, we help them get testing. We resource to get them testing immediately, and provide that kind of support to them to identify if they're become a case. And we also do that with those that are positive, that are in isolation. We monitor them, we ask them to be monitored daily. At the completion of that monitoring, then the benefit of that monitoring not only is the support and resourcing and making sure that we are containing this by separating those people out of the community for the time that they need to be separated, but they get a letter at the end of that monitoring, electronic letter that they can provide to their employer. Schools are requiring it for their students and staff to return, that says that they've completed the process and they're safe to return to work or to school. So that's kind of an overview of what everything looks, what it would look like. It can be a lengthy interview, depending on, the movement of that individual and a number of contacts. But just, why this is so important, and I just want to really emphasize this and give an example, why this works, and it's so important for public health is, just for instance, we had a situation where it was a sports team that an individual on that sports team's family member, there was a case in the household. So we quarantined that individual, was not symptomatic, put them in quarantine at their house. And eventually they did develop symptoms and tested positive for COVID. So the concern was the exposure to that team. But because we quarantined them and they cooperated with the quarantine, that team was not exposed. And therefore, we didn't need to quarantine them because they were not close contacts. So this is where it works, that by doing this, we're cutting down the number of people that could potentially be exposed and basically breaking that chain at that point of spread and reducing the spread and keeping that curve flat versus exponentially expanding by those. If that individual would not have quarantined appropriately, would have caused exposures on that team.
Absolutely. And I know we're getting, close to our time limit here. So I just want to ask one more question. I think something that's on the minds of many right now, where, just sort of recently we've had to really take a step back. We have these mitigation measures that have been placed on us here in McHenry County, as well as the whole of the state at this point. A lot of folks are worried about, restaurants and other businesses that are having to, try and stay afloat during this time with enhanced mitigation measures. And I wonder if you could, highlight, like I mentioned a few things that the governor has said along this plane at the beginning of our interview, but if you could, you've just spoken about the importance of contact tracing in sort of controlling the spread, but more directly, why is contact tracing and efficient and, having everyone participate, why is that important to being able to maybe get back to a place where we're able to reopen our economy a bit?
Right. It's important because it's going to break that chain. Right now, we have widespread at an alarming level of COVID in our community. If we can bring that down, back to where we were in the summer, that's going to be able to allow business to open and function and resume business. But when it's this widespread and at this level, the risk is very high in all these different venues. The most important thing with the contact tracing, and why, if we would have better cooperation, we would have more refined data on where this transmission is actually happening, so that we can be more strategic with our mitigation interventions. But right now, because especially in McHenry County, we don't have that level of cooperation, we're not able to really strategically say where our concerns are and what we need to do to fix that, to mitigate. So it's almost like we're being painted by the state then with this large brush, that, okay, we're going to shut out, we're going to ask everybody to shut down. Do we have proof, is what we've been challenged with. What is the proof that it's the restaurants and the bars? And we really don't have that good data here. I'm not comfortable with the data that we're seeing because we're not getting that cooperation. People aren't sharing where they've been. So we don't know for certain. We do know that COVID does spread in large groups very easily. So we could make that assumption that in bars where there's a lot of, people in a small area congregating, talking, and with their masks off because they're drinking or eating, that it could be, we can make an assumption that that's a risk because of what we know of how COVID spreads. Do we have the proof that that's actually happening? In McHenry County, we do have outbreak data, but again, we are, I'm not completely confident in it because of the rate of lack of, the high rate of uncooperativeness.